Everybody, my name is Miguel A. Gonzalez, and this is going to be my critical assignment overview on the COVID-19 pandemic. Hope you guys enjoy it. So, what is COVID 19? Well, as of right now, everybody in the United States and across the globe really know what COVID 19 is. But for the purpose of this assignment, we're just going to overview quickly what it is. So, officially, it is the SARS-CoV-2 virus, which was founded in Wuhan, China, as of December 2019. And essentially, what it is, it's a virus that attacks the respiratory system. So, this affects the overall breathing. So, this can lead to fevers, severe pneumonia, respiratory distress syndrome in severe cases. And of course, there's certain classifications that were affected more than others, right? Depending on age, health habits, and also underlying diseases. So, and as we learned, this virus is actually highly contagious and it spreads through respiratory droplets, sneezing, coughing, talks. I was actually, I've had COVID a couple times already, so one of the worst downfalls, I think, is the loss of taste and smell that comes with the virus. So that's pretty much what the COVID-19 virus encompasses. But throughout my research, the first thing that I wanted to establish was the policy domains that was established throughout this pandemic. So, of course, the first policy that went into consideration was the overall lockdown, right, that we had, which was recommended through the World Health Organization. And with that came also mask mandates and social distancing. As we can see in some of the photographs, this was very common to see. Now, not so much, but at that time, you had to remain 6 feet from people. You had to wear a mask everywhere. If you didn't really need to go out, you shouldn't. And non-essential businesses were also closed. And there was also an increase in hospital beds and also sourcing for medical equipment because, of course, we knew that our healthcare workers were the frontline defense against this virus, and we saw emergency rooms, urgent cares just flooded with people with this virus or similar symptoms of this virus. So that was a also different policy in aligning the right equipment for these healthcare workers. And also, we saw the rise of telehealth, and this was actually really convenient during the pandemic because you were able to see your doctor in person through either MyChart or through a different platform, and allowed people who did have the virus or were sick to avoid a doctor's visit, because essentially most of the time they just see you and you just get a prescription. So this actually gave rise to telehealth, which is actually evolving in today's time now as well. So our first dynamics into policy problems is how did the three levels of government respond to this pandemic? So the first level of government, of course, is the federal government. And of course, the first thing they did was travel restrictions, right? Because they were trying to prevent individuals who were coming overseas who could potentially have this virus bring into the United States. So that was the first thing they wanted to do, and they established social distancing, and of course they started recommending the mask. Originally, it just started as a public service announcement, and then it evolved into a full-blown pandemic that essentially took over the world. So that's how the government started, by doing the restrictions and also imposing social distancing and wearing masks. And also, the federal government launched something really interesting. What's called Operation Warp Speed, which was a partnership with public slash private companies, and that whole purpose was to accelerate the distribution, manufacturing of vaccines, and also tests that were done to be able to identify people who had the virus, and also a vaccine to be able to combat the virus in itself. So there was a lot of funding that went into that and partnership. And of course, we have the infamous the CARES Act, right, which is one of the biggest economic packages that I think the United States had seen in its history. And we all remember receiving our stimulus package check in the mail. If you made a certain amount of money, you would get one. Of course, at the end of the year, you also receive some sort of aid to combat the overall dynamics that were occurring in the economy at the time. So subsequently from the federal government was the second level of government, which is the state response. and I did mine on the state of California because that's where I reside. And the first thing that was established was the statewide stay-at-home order. As we can remember, pretty much everybody that was non-essential was mandated to stay home, and this included many businesses who unfortunately went under because they weren't producing any economy in a sense. So they were forced to close down. Also, many public places you weren't allowed to gather, like beaches, parks, and so forth. And if you were allowed to gather, you had to wear masks and establish social distancing. So, and of course, mask everywhere. And if you could receive the vaccine, you would receive the vaccine. That was highly recommended at the time. But one of the interesting things that California did was Project Roomkey. So what that was pretty much essentially grabbing as much homeless individuals as possible and getting them a place to stay. Would it be a hotel or it would be a motel? But the whole purpose was this to try to deter the virus from spreading amongst this population or this community. So, in line with that, Governor Newsom passed a law where also landlords couldn't evict individuals during this because the economy was struggling at the time, and they were also trying to avoid people, pretty much going home to home and possibly spreading the virus. So you weren't allowed, if you were a landlord, you weren't allowed to pretty much evict anybody. And then it slowly moved into as long as you're paying 15% of the rent, they can evict you and so forth. But now it's essentially gone back to normal. And of course, the state at the time was promoting a lot the vaccine. I remember they even had like raffles and prizes and even money wins that you could get if you were vaccinated and you entered into their game or their raffle. Also, additional prizes that you could get. And they did that to try to promote as much people as possible to get vaccinated at the time. And finally, we have the third level of government. And from this perspective, I wanted to do a little bit something a little bit different. I wanted to speak pretty much my humble opinion from a first responder perspective, because every county in California, as we know, regardless of the state orders or the federal orders, everybody essentially did whatever they wanted because LA County was one thing and San Bernardino County was another thing. And the further south you went, like San Diego County, there was a whole nother ball game there. So, from my perspective, I noticed that the county was pretty much attempting to mimic what Los Angeles County was doing in the sense of mask mandates, social distancing, and keeping only essential businesses open. However, that really wasn't enforced, at least in my city, and as well as a first responder. We never really responded to stuff like that to close down businesses or force people to wear a mask or force individuals to get vaccinated in the context of as an employee, right? Because I know Los Angeles County was essentially pretty much forcing their employees to get vaccinated or they would lose their job. San Bernardino never did that. So if you're a county employee, city employee amongst that population, you weren't really forced to take the vaccine. So there was left up to the individual. So that's what was different. A second thing was there wasn't any proactiveness towards gatherings as well, especially during the holidays. We would get numerous calls about people allegedly, gathering more than six people. We really didn't enforce any of that stuff. It pretty much just stayed the same as usual. If it was something, like a misdemeanor, we would respond because, as many people don't know, the bell was set to zero. So you would take somebody for a misdemeanor and literally they would walk out before you would even exit the parking lot. So unless it was a high profile crime or a felony, then of course we would respond. But most of the time, we didn't. It was just directed to online protocols. And of course, the county did do a very good job in establishing different test sites. They were all over the places and major sites like malls and big, lit areas and with huge parking lots, and you would see lines and lines of people who would be able to get tested on a daily basis. So that was their perspective, and of course, they managed to help out the small businesses as much as they could and take care of the employees, like giving them like a first responder benefits for safety hazard pay, I believe it's called. So they take care of the employees and also its citizens, provided free testing kits, advice on how to get a vaccine or further testing done. And this concludes my presentation. Hope you guys enjoyed it.